As is typical for our second Tuesday meeting, we have an update regarding COVID-19 from Cobb Douglas Public Health. I will turn things over to you, Dr. Memark and Lisa Crossman.
Thank you. Thank you for having us today, and we'll go ahead and give you our update. All right, so what we're looking at today is a number of 1,167 per 100,000 for the last 2 weeks. And we want to apologize, some updates that we had sent yesterday. The DPH dashboard was acting a little wonky, so we actually got 3 different numbers yesterday, and so they sent out a release that they were having some trouble with the dashboard. So this is a current number that we have today, which is still indicating a decline. When you look over to the right at the epi curve, you can see that we're finally making some progress on a downward progression from this Omicron surge. So definitely some good news, and we're heading in the right direction, and state numbers are also going with this nicely. So good news so far, but remember, still very high. So 1,167 is still 10 times, 11 times over what's considered high transmission. So we are still battling quite a big surge right now in the county. When we're looking at our percent positive, we can see that we're at 17.3% of those PCR tests are coming back positive. So that's also in the right direction. We were at very, very high numbers, over 30% for that. So we're heading in the right direction as well. You can see on the right, that curve also supports that. And then when we look at hospitalizations off of the CDC website, we also see that we are finally off that peak as well. And so we have been seeing the last 3 weeks in our area hospitals, we have been seeing a decline from our highest numbers. That being said, we still have a lot of patients that are in the hospital right now with COVID-19. And so we're definitely not back down to our lowest levels with that surges, but we are at higher numbers. And so we would like to see, and continue to see that go down. And as the story continues to tell for us, we continue to have the majority of our patients that are in the hospitals to be unvaccinated. Studies that are coming out right now and from the CDC from last week showed even starker differences if you have received your booster shot. So it's very important if you get your booster shot, you get a lot more protection against hospitalization and death. Remember, anybody 12 and over is eligible to get that shot. So it is important, especially if you're more than 6 months out from getting your second dose, or 2 months out from Johnson & Johnson, your immunity is going down a bit. So it's time to get that booster shot. This is a breakthrough report off of the DPH website, and you can see the differences between being fully vaccinated, having that booster shot, and being unvaccinated with breakthrough cases. In Omicron has shown us a little bit of a difference. We are seeing more breakthrough, and that's probably the combination of what I told you about, of having our immunity kind of going down, but also we have a virus that was much more adept at evading our immunity. Here is the breakthrough for deaths, and you can see even a starker difference as well. And so if you were unvaccinated, you have 3.6 times the risk of dying from COVID. And so it's very important, once again, that getting that booster shot and fully vaccinated, how helpful it will be for everyone. Okay, so Omicron has taken over, and so we have seen this now for several weeks now. It is the predominant variant that we're seeing, and I do believe in these numbers, they are adding together the different sub-lineages of Omicron. And so I'm going to talk a little bit about what has been on the horizon and in the news a little bit, which is BA2. That is the second lineage off of Omicron that has come off. So this is a mutation of a mutation. And so this one has 27 mutations from its parent Omicron, which is BA1. It is thought to be at least as transmissible or maybe more transmissible than the original Omicron. Now, the good news is it does not seem to be more severe. We're watching countries right now like Denmark, and it has taken over another Omicron, the original Omicron in Denmark, but it has not been causing more hospitalizations. So that is very good news. Right now, it's in 57 countries throughout the world, and it seems to be gaining speed. Now, important though is that we're still seeing some coverage with our vaccines. So once again, if you have your booster shot and your full dose series, you are offered a lot of protection. It's not 100%, but it's doing a long way to keeping you out of the hospital and from dying. So very important, and we keep watching this one. But so far it's not a variant of concern quite yet. So here are our best protections. We know what we need to do is we need to mask up and we need to vaccine up. And so what they're showing is that, to have, make sure you have the best fitting mask that you can. And so just kind of having the chin guards is not going to be very helpful. So being able to have a well-fitted mask. Now, of course, top of the line gold standard is N95 if you can get them. And Lisa will talk a little bit about the free mask program that's been coming out. So, but they are not readily available as of yet. So she'll talk a little bit about that.
So good morning, everyone. Let's talk just a little bit about testing. So we continue to offer free testing around the county. It's very easily accessible by all our residents. We've got sites over at KSU, the Epicenter, the East Cobb Health Park, and Jim Miller Park. At some location around the county, we're doing testing 7 days a week. Also, a number of pharmacies and physicians' offices are also continuing to offer testing. We're not seeing any wait times at our mass sites, and our results are generally coming back in 12 to 36 hours. I didn't put all of the locations and hours of operation just because you can find that on our website. You can also go to the Georgia DPH website for other testing providers that might be near your zip code. The federal rapid home test. So remember, I think we've talked about this before at some other events, that website to order the free federal home kits went live on the 18th of January. It really is extremely easy. I've helped a number of folks. It literally takes about a minute to register to get 4 test kits delivered directly to your home. A lot of people have reported that those test kits are coming in to their home within 2 weeks. Also, beginning mid-January, residents with health insurance could also go online to their health insurer or to a local pharmacy and pick up test kits. In some cases, their plan directly paid the pharmacy. In other cases, they had to get a receipt and turn that into their insurance. But I'd say check with your pharmacist or your health plan for options if you wanted to get your kits that way. And then a lot of people have been calling about the free mask, the federal mask program. Remember that that's been announced and is available, but please know that those masks were sent out to national chains pharmacies that were enrolled in the federal vaccine program. So your chains like Walgreens and CVS and Walmart were the ones who got those masks, and the quantities were really limited. So I'd say check with your those locations first before you go over there. In some cases, they're also putting signs up if they've gotten masks or not. Public Health has not received those yet. We're still waiting. And also some of the community health centers, like the federally qualified health centers like Good Samaritan and Family Health Centers of Georgia, were also in line to get some, but I don't believe we've gotten those yet. Those are coming directly from HRSA. All right, vaccinations. First of all, to remind everyone that anyone 5 years and older is eligible to get their vaccine. Anyone 12 years and older can get their boosters. And the additional doses are still recommended for those who are immunocompromised. Public Health is providing all of those vaccinations that folks need. And as Dr. Memark mentioned, we really want to make sure that people hear that they need to get their booster. We are seeing breakthrough cases with folks who got their first 2 doses, but then it's been several months since their second dose. So we're encouraging that. This is just to give you an update of our vaccination status in Cobb County. So in Georgia, we have 62% of our residents have received one dose, 55% are fully vaccinated. That's tracking a little bit lower than the US rate, which as of the other day had 80% had received at least one dose. So we're tracking a little bit below the US. Cobb County is doing a little bit better than Georgia, but still tracking behind the United States full number. We have 65% of our residents have received one dose and 59% are fully vaccinated. 25% have received that booster shot. Again, there's no obstacles, I don't believe, for folks to get their vaccinations if they want that. All of our public health clinics are offering those, many times on Saturdays as well. Many local pharmacies are also offering regular vaccination services. Our public health staff, along with our core partner, are providing 5 to 10 community vaccination events outside satellite locations each week. Lyft is still, remember through June, Lyft is still providing free rides to vaccination sites for folks who need that. And then homebound vaccinations are still available through public health and our partnership with Pools Pharmacy. You can go online to look at which vaccines are provided at what locations and their hours of operation. You can also go to the vaccines.gov site for other providers that might be near your zip code. We're also trying to do a lot of other things to help provide support to our residents across the county. So one partnership that's continuing is with the Center for Family Resources and Sur Familia to fund, public health has been able to fund some additional resource coordinators that work through those agencies to help families with housing and access to other care and utilities that they may need. And so we're continuing that partnership at least through June, and hope that's helping to link folks to the care that they need. We also have recently gotten about $500,000 from the CDC and through Georgia DPH to fund some health navigators in the community. So one level has been partnering with Morehouse. That contract had to go through a lot of legal review because it was kind of the first contract in Georgia that we've done. And so I'm fingers crossed that within the next day that's going to be signed, but we're still planning on getting those health navigators launched through across the county by early March. And then we also have another health navigator that's been funded to focus on linking residents in South Cobb and in Douglas County with chronic disease services, not just COVID, but linking them to the other services they may need that may have been neglected during the pandemic. We have a lot of folks who haven't taken advantage of their health checkups, or they may need other rapid tests, or may need other immunizations. And those have kind of gotten put on the back burner since the pandemic started. So we're hoping to be able to make sure to link our families to the care that they need. So in general, the takeaways are that we still are strongly encouraging residents to get vaccinated and to get boosted if they're eligible. Testing sites are readily available. There's no wait, and result times are much quicker. And then we still, during this surge, although rates are looking great, they're coming down nicely, but during the surge, we still recommend wearing a multiply well-fitting mask, especially when you are indoors in crowded locations. Watch your distance, wash your hands, and just be careful of large crowded indoor events. Dr. Memark, other things that you might want to add?
No, I just wanted to also just let everybody know that Moderna is now FDA approved for 18 and over. So we have 2 FDA fully approved vaccines for COVID-19. So I think that's some great news. And so they will continue looking at those vaccines as well.
And I think there's some conversations right about toward the end of the month that they should be looking at the 6 months to 5 years of age, correct?
Yes, they're trying to release that as well.
So we'll keep you updated on those.
Mm-hmm.
Thank you so much.
Thank you.
Thank you, both Dr. Memark and Lisa. I know a lot of parents are looking for hearing more about the younger persons who can be vaccinated. Commissioners, do any of you have any questions this morning for Dr. Memark and Lisa Crossman?
I do
Well,
not, Madam Chair.
Thank you. Thank you both for your presentation. Again, appreciate all that you do. Hope that you all continue to stay healthy and also encouraged. I know it's encouraging to see the numbers go down, but that doesn't mean that the workload is getting light for everyone that's in the medical and public health arena. So just thank you for enduring with us during this time, and we hope to see these numbers go down when we have our next presentation before us.
Thank you.
Thank you
Feel
so
better.
much.
Feel better.
Thank you. Thank you. I appreciate it. I am on the other side of COVID, still in my 10-day isolation period, but am experiencing some of the breathlessness that does come with it. And so certainly appreciate all of the advice that you've given us over the past going on now 2 years, and hope that our public will take to heart a lot of the precautions that you've shared so that we can all stay healthy and get through this.
Take care.
Thank you.